Hello, everyone. It's a pleasure to be with you. I'm truly honored that our work and our advocacy work and the patient engagement work has been recognized in the Made with Patients Award 2025. I'm Behijة, living with leukemia since 2002 during pregnancy. I'm based in Marrakesh, Morocco. And I faced many challenges as access to treatment. Treatment was not available in Morocco at that time. Care centralization, I had to travel to see my doctor, and also all administrative, struggles, lack of support, and health insurance and the reimbursement issues. And all these challenges motivated me to found the Amal Association based in Marrakesh. And from the very beginning, our goal was very simple, is to put the patient at the center. And we ensured quality patient engagement by designing initiatives that are responding to real needs through support, prevention, and awareness campaigns in schools and media, especially to reduce stigma and educate both patients, parents, but also GP to avoid late diagnosis. So advocacy has been also at the heart of our journey to ensure access to a personalized treatment. And we are very proud that our efforts have led to meaningful changes for leukemia patients in Morocco. In fact, we held two landmark meetings with the Minister of Health to secure access to the first line targeted therapy, and another meeting to achieve reimbursement approval for second line treatment. Next slide, please. Another challenge faced by many patients, especially those living in rural area, and they are very poor, who could not reach hospitals. So to close this gap, we built a home where patients could be treated with dignity. And that dream became a reality in September 2022 with the inauguration of Dar al-Amal. And we inaugurated this house during the World CML Day in Morocco. Next slide, please. And this facility now provides zero-cost services for all beneficiaries, as accommodation, transportation, blood tests, medicine, food, clothes, internet, but also peer support. Because people, patient and parents, they are living together in the same house, they are sharing, stories and doing activity together, and so it's good for them to overcome, the cancer. Now, as a result, this project is reducing treatment abandonment, improving efficiency, especially for healthcare systems, contributing to education, prevention, and stigma reduction. Next slide, please. Here are some powerful lessons we have learned along the way. And the first one is listen deeply and let patient priorities lead the way. And the second one, for anyone starting something similar, my advice is start small, but start. Even with limited resources, without government funding. I still remember we started Amal with only 200 euros. And from there, we built our skills, knowledge, relationships, reputation, trust, and strong advocacy. And the third one, build bridge with healthcare professionals and authorities to focus on solutions rather than problems. And number four, partnerships. Partnerships are essential, and working together creates sustainable change and make care more human and meaningful. And the last lesson, the last one, is always to measure and share your impact, because evidence combined with the patient stories is what sustains initiatives like this. Next slide, please. I want to share this photo and these pictures, lovely picture with you, because I believe that patient engagement is not about perfection. It's about authenticity and to continue learning, and it's about empathy, about valuing patient lived experiences. And this recognition not only honors our journey, but also gives visibility to the Moroccan experience, to the Moroccan patient community by opening new connections with global advocates and creating opportunity to exchange best practices and also to adapt at a local level or setting. And believe me, I didn't win right away. Last year I was nominated and this year I was awarded. And sometimes we all want quick results, but it's important to keep growing, improving, and staying inspired until the end, because sometimes we are just one step away from achieving our biggest goal. And sometimes it's very difficult, yes, but never impossible. There is always a way to achieve what we want, as long as we stay true to our values and keep our motivation strong. Thank you very much.
Thank you, Behijah, and that's a very strong message. I really like it, especially when you described how you grew this community in the past few years. Like, it's impressive to see the progress, as you said, from 200 euros to building a house for a lot of more than 800. Like, I mean, all the numbers before were amazing. So thank you very much. Do you have any questions for our awardees or insights, considerations to share at this point? Voila.
Just say yes, a massive congratulations to you both, and I love Behijah that you talked about you sort of didn't get it last time, and it was the you know, sort of that drive to continue, and that, you know, that's very much, it's not about sort of doing more, it's about sort of us as juries being able to be aware of what it is you're doing and the importance of it. So just a really big thank you for that. But I just wanted to ask, has anything changed since being recognised through the Made with Patients Awards for either of you?
At personal level, it's a good recognition, yes, to just recognize our work sometimes as a leader, as advocates, as a patient, but also we are doing our job, we are taking care of our family. Sometimes such recognition is good for us to motivate us to go on and to move on, and to tell us that everything is possible. We have to work and we have to learn, we have to share. But also give us this visibility when we are sharing on social media as we are the winner, because our intention in the beginning is not to be a winner, but leading some initiative and working and improving, you know, patient community and especially access and education and reducing stigma and so on. And yes, many people, for example, they came, they asked us what about this award, especially in English. They are requesting, you know, translation in Arabic or in French, because in Morocco we are speaking French and Arabic more than English. And I have been contacted by 2 journalists just to talk about this, and just seeing that the patient is not only a patient, it's someone who has the responsibility to improve condition of care in his country is a responsibility, but also we have to take care of this patient. It's not only a patient, but he is an expert. He have a knowledge. He, for example, in Morocco we have the degree about patient expert degree in University of Medicine, and I got this degree in 2021, and now I am trying to monitor other cancer organization in Morocco. And when they invite me, for example, in this radio show, and they give me the opportunity to talk about this new patients and this new concept of patient experts and patient advocates, and that the patient should be in every committee, maybe even that the building, the construction of a hospital. Last July, I have been invited a meeting, a congress in Rabat, the capital of Morocco. They are talking about l'hôpital de demain. This is the hospital of the future, of tomorrow. How can we build this hospital. And I said the patient should be consulted, because sometimes we have all walls in white. Everyone is wearing the white, and it's crazy. No colors, no thinking about the patient. And this is our role as a patient advocates. In the end, maybe we will have many awards, but in the beginning we have to start working on patient needs, education, and reducing stigma, and also building this bridge between us and the healthcare professional, and maybe speaking the same language. I hope I answer your question. I was very, 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 very happy and honored to be with Lara, my dear Lara, together in the same stage, celebrating our this award is something very, very huge for me and for her, so for sure, because we are working for free, as she said. We are volunteer, and we have many volunteer commitments, with our job, our families, and so on. I want to add something, that sometimes when we are bringing, for example, I was awarded as the first civil society personality in Morocco in 2017. Yeah, I was invited by many journalists, but when you are bringing award from an international award, it's more valuable and more, it's more important, because in Morocco, maybe people, they are knowing me, but in the international level, people, they are trying to know me through my work, my advocacy, my patient engagement, and this is something very, very important. In my country, low income countries, when we are bringing something for, from the foreign, experience, it's more valuable than national one. Thank you. So I want to add something with you, just to share something with you, very, very important. When I start, attending my first international meeting, it was in 2002. It was ESMO. And I was unable to say a word, and they say, oh my God, everyone is speaking English, and I am speaking only French, looking about the French people, Canadian people, from Belgium and so on. And they say, next time I will not attend any meeting. But 2008, again, I was invited. I said, Behija, look, this is a big step. Are you, ready to start this, new journey to learn English? And say, no time. I am my family, my children, my job, and all other commitments. And when I attend in Bavino, in the same place of PIOF, I was enabled 2008 to say a word. Only the words I was able to say, hi and bye. And when people, they see this smiley face, they came, hi, where are you from? And said, bye, because I couldn't understand what they are saying. And they said, look, Behija, you have to do some sacrifices if you want to improve patient community and patient, involvement and so on. And they start learning English till 2 p.m. or 3 a.m. when I give shower to my children, I cook the dinner, and I start answering this long email just to understand, without ChatGPT, without anything, only me and the laptop, start trying to understand. And I learned by the hard way. Even my poster, I learned Canva. I learned how to make a good presentation, how to make a good, impress my audience. And I start, of course, I'm a university teacher. I'm teaching communication, but in French. And I said, yeah, you are smart, Behija. Maybe you can't speak in English, but you're still the same person. You are smart, you have dreams, and you can do it. And I encouraged sometimes myself, sometimes by crying, sometimes by laughing when I finish a late email, but I succeed. Now I am not looking at my English or bad pronunciation. I'm looking to the impact that I can do. I am looking that people, they can hug me and they can feel Behija and feel my dreams and feel my the impact I have, I did in with my community. Thank you. just to add another point is about flexibility, because flexibility is a key to build something, a new initiative. Sometimes we have a big dream, we have a lot of things to achieve, because we have this adrenaline of creating something new, but you face many challenges and then you stop or you change your mind. It's not for me. But if you are flexible, you can, for example, you can achieve your dream. For example, when we decided to build this house, it was supposed to be near to the hospital, but the land near to close to the hospital is very expensive. And then we managed to be flexible and then to build in another place less expensive. And we had this idea about asking someone, a sponsor or a partner to buy 2 cars to allow us to transport, to make transportation for free to patients. And we built our house. Otherwise, we will stay waiting. And sometimes people that are in this waiting room, this is what I said to my students: avoid the waiting room. We are staying with your pain, with suffering, crying. It's enough. If you cry 1 hour, it's enough. Move on and go and do something and use your pain and use your suffering to create something beautiful. Thank you.
Thank you, Bهيجة.